cropped up or have got aggravated if they already existed. So, one and all, I welcome everyone to the webinar series on better health and fighting COVID, on mental health in COVID times. My special welcome to Dr. Rakshana Singh, HOD, Holistic Medicine and Wellness at the Artemis Hospital, Gurgaon, and Director at the Mind and Wellness Studio. As also a special welcome to Dr. Ratika Sharma, Consulting Psychiatrist at the Gurgaon Multispecialty Clinic. I'd like to thank our co-chairs of the Hospital and Diagnostics Committee, Dr. Sameer Gupta, who's also the Director for the Cardiac Cath Lab at the Metro Group of Hospitals, and Dr. Deep Goel, co-chair of the Hospital and Diagnostics Committee of PhD Chamber and a Senior Director and HOD of Robotic Surgery at the Dr. B.L.K. Kapoor Hospital. Max, I think Max Hospital now, I stand corrected. They've Max B.L.K. Hospital, I think that's what it's called. Am I right, Dr. Deep?
Yes.
Thank you, thank you. So let's start the evening, which is going to be full of knowledge, with a welcome address by Dr. Deep Goel. Over to you, please.
Thank you, Vivek. Thank you very much for starting this particular very important event. I would, on the behalf of PhD Chamber of Commerce and Industry and from our Hospital and Diagnostic Committee, would welcome all of you today, especially Dr. Rakshana and Dr. Ratika, for being here and spending time from their busy schedule. Both the speakers have been introduced by Vivek. And as we know that, PhD Chamber of Commerce work very, very closely in partnership for the progress of industry and the government. And it works at a grassroots level for international linkages, for propelling progress, harmony, and integrated development of Indian economy. And we also very keenly and very passionately are involved in the healthcare industry. And we really make sure that how we can help in making our country and the people of this country healthy and how we can aware them about various diseases. And as we know that, this particular COVID outbreak was declared a pandemic, an emergency in January 2020. And it has affected our lives in more than one way. We know we are obviously, we see all the physical effects it has done, all the economical effect it has on us. But what we normally, tend to ignore or which we can't see very clearly is mental health issues. And as our country, we all know that we are not very, very aware or conscious about the mental health issues. And so this particular pandemic has really hit us very hard because of the prolonged quarantine and isolation, especially in the younger generation or geriatric population. I don't think any particular age segment has been spared. And that is what it is. What is important is to understand that there is a problem. What is important to know that there is help available, and you will be glad that Government of India has announced National Tele-Mental Health Program, where they're going to have 23 tele-mental health centers of excellence, which will be, associated with NIMHANS and IIT Madras, which is Bengaluru, sorry, which are providing the technological support. These are 23 centers which will be specializing in giving consultation and looking after the mental health. So I think it's time that we, equip ourselves to understand our mental health and take help. So we not only get better on our own, but we are equipped to take care of our near and dear ones. So with this, I would request Sameer to take forward the program.
Thank you so much. Sorry. Thank you,
thank you.
Sameer. Yes. And I must thank you for the opening remarks and the welcome, and will request Dr. Sameer to come up with his initial remarks, and of course then take over the session for moderation with Dr. Ratika Sharma and Dr. Rakshana Singh. Over to you, Dr. Sameer. Sorry for the interruption.
No. Thank you so much, Vivekji. And I would like to thank you, Dr. Goyal, for the welcome address. I would like to just take this opportunity once again to welcome all the delegates who've joined in from across the country. I would like to thank our esteemed guests today, Dr. Rakshana Khanna Singh and Dr. Ratika Sharma, for joining us today. And I'd like to reiterate that a small incident that happened when I was back in training, when I was actually in medical college. I was out I was just having dinner with a few friends. And there was one of the persons over there was a psychiatrist. This is about 20 years ago. I'm really not that old, but yeah, it was a long time ago. And so, we were all just talking and we were having dinner and having a good time. And we were talking about what professions, what post-graduations we want to take. And one of my friends said that, depression and psychiatric illnesses are only diseases of the rich people. And that was about 20 years ago, right? And since then, there's been a marked change in the perception, in the outlook, and all these psychiatric illnesses are now being brought to the forefront. And I think and as a practicing interventional cardiologist, as a doctor, you understand the plight of the patients who are suffering from these mental illnesses. When somebody has a heart condition, when somebody has a heart attack, it's only the patient who's suffering, and that's it, right? Our family members may be affected, but it is that patient who's basically bearing the brunt of everything. However, when somebody has a psychiatric issue, when somebody has schizophrenia, when somebody has bipolar, when somebody has a personality disorder, it is just not that patient. It is the entire community around him, which actually, to a certain extent, takes the toll of that illness. That person may be talking gibberish, or that person may not be getting out of the house, or he may be the entire physical thing of that person is changed, and the entire community around him also gets affected. So that is how mental diseases affect the community. It is not just that person who has the diagnosis, it is everybody around him also. And it's very good and reassuring to see that the government in the recent budget has come out with the national health policy and what they are doing towards uplifting of mental illnesses and getting them in the forefront. I would also like to just tell you about another small incident that happened with me. I'm the managing director of a senior and assisted living facility in Gurgaon. It's called Aurum. And some of the residents, though this is just senior residences, I'm also involved in the senior care platforms and senior care elderly forums. So one of the persons over there told me about an incident where where they're running a not-for-profit for dementia patients. So that particular gentleman went to the ministry and was requesting them funding for their dementia unit that they're running. So the immediate feedback that the person gave was कि मैं पागलों के लिए थोड़ा ना तुम्हें पैसा दूंगा. And that is, once again, just to reiterate, and this was also a while back, a few years ago, but this also kind of reiterates the stigma of mental illnesses in the community. And it's great to see, sports people, Bollywood stars come forward. When Deepika Padma came forward and said, I had depression, this is a reality. This was, and when there were other such Bollywood celebrities and Hollywood celebrities who come out and said this in the forefront, it is something which is very good for the community, for mental well-being, for just health in general, because mind over matter, right? That's what the two speakers with me would kind of agree with. But that being said, I'm excited to see what our two speakers are going to talk about. The COVID times have certainly aggravated the mental illnesses. There were patients who were not able to get treatment for heart attack. There were patients who were not able to get treatment for cancer, or who were getting delayed treatments for all these diseases. But I think mental illness really came out in the forefront in the pandemic. There was so much talk about it on social media, so much talk about it on other platforms, that it's very good to see. So with that, welcome Dr. Rakshana, welcome Dr. Ritika, welcome to all the our esteemed delegates who've joined in virtually. And I would like to, and Dr. Ritika has already been introduced. She is a psychiatrist who is who was previously with Medanta and is currently with Umkal Hospital, and she is also a part of the clinic in Gurgaon. So thank you so much, Dr. Ratika. Welcome once again, and now the floor is all yours.
All right, all right. Thank you so much, Dr. Sami, for your kind introduction. And like Dr. Ravi mentioned, that we'll straight get to the point and start with our presentation, not wasting much of the time with my tiny sense. Okay, so Dr. Ravi, if you could please share the presentation. Yes. So today we'll talk about mental health. Mental health, especially in times of COVID. Next slide, please. Next slide, please.
Is the slide visible? Next slide.
Yes, you can enlarge it.
Okay, just give me a second. I'll share it again. Is it visible now?
Yes, yes. So today we'll discuss about mental health in COVID times, how COVID has affected, various mental health conditions, and how people have, come up with various kind of issues that affected them. And like I can see that we have almost 67 participants. So they're also from, non-doctors and people from not from the medical background. So this is for the general public. So this is a very basic presentation that we've made here so that it's easy for everybody to understand. And I'll be conversing in English and Hindi both. All right. So next slide, please. Next slide, please, Dr. Ravi. All right, so I'll begin with a case presentation. I had a case recently of a 36-year-old male. He had, presented for an online consultation, and he was a 36-year-old man from, he was married. He had 2 children, around 6 and 9-year-old girls. And his wife was also working from home, and he had an old mother, so who was staying at home. So he was working with a multinational company as a team leader, and from a very middle class average family. So he presented with symptoms that he contracted COVID, and although it was very mild, he had only mild symptoms like cough and flu-like symptoms and fever and all of that. There was nothing major, COVID complication or anything of that sort. So but fortunately his family members, they were negative, COVID negative, and so he had to isolate himself in a room. So his concern was that what if the rest of the family members, they contract COVID, and what if he has some sort of complication and he has to be taken to the hospital, or any uncertainty that comes up, and the old mother, little children, the wife, how will it be possible for them to reach out anywhere for help? So he had a lot of anxiety symptoms and a lot of sleepless nights, and his constant worry was about the uncertainty that is going to be there, that what if some complication happens. So you see, जब भी कोई पेशेंट को, या ये हमने सिर्फ एक केस प्रेजेंटेशन लिया है, बट फॉर एग्जांपल अगर कोई भी क्लाइंट जिसको ऐसे होता है, इट इज वेरी नेचुरल टू हैव ऑल दीज फीलिंग्स, so there is please next slide please. So there is fear of helplessness, because like we saw in news and we saw in media and everywhere, they were reporting that the hospitals were full, the capacity was full, COVID के लिए beds नहीं मिल रहे थे, normal patients were also suffering. Somebody like Dr. Sami mentioned, if somebody had a heart attack or somebody had such kind of ailments, उनको hospital जाना मुश्किल था because all hospitals were closed. So he had all these imaginations in his head and all these concerns, and uske baad he had a lot of fear of helplessness, this feeling of helplessness. So there's always a sense of unable to act or react to a negative stressful situation or a traumatic event. That's what is fear of helplessness, and it's very natural to have these feelings. Next slide please. Then he also had fear of uncertainty and unknown, which is also a very natural response which one has. Pandemic has increased this fear of uncertainty in people, because people have started to become uncertain of their finances, because there were a lot of jobs which were, people were fired from their jobs, big companies were shutting down, and people were asked to move back to their home places because there was work from home. and the salaries had gone down because of the economy, loss in economy and all of that. So with all of that, the uncertainty with finances, economy, health, relationships, all of this much lies very uncertain. And I remember there was this lady who had reached out for a consultation. She had not spoken to her brother for almost more than 10 years, because of their personal conflicts. But because of the pandemic, she realized that life is so uncertain, and she needs to she needs to reestablish that connection. And so she reached out, to the brother, and then they got in touch, and they reestablished their relationship. So all of these examples that there is very much fear of uncertainty and fear of unknown, right? Then with pandemic, next slide please. There's fear of death, because see, we had seen in the news that a lot of people, this fear of death had increased in the pandemic because COVID, because see, doctors and all the medical fraternity, they had no knowledge about COVID at that point of time, about the virus. And there were no standard treatment guidelines at that time. And there were multiple deaths that were reported, and there was chaos everywhere. There were these scenes where, bodies were being sent to cremation houses, and they were lined up over there, So with all this, the fear of death increased during the pandemic, right? So this is also a very natural fear which comes up in people. Then next slide please. Then there was fear of losing loved ones, So see, the immediate thought which comes up in somebody's mind in such scenarios and situations is that, what if I'm left alone? That's a very miserable situation. That's the biggest fear. Or seeing your loved ones in pain and seeing them suffer, that is a very unpleasant feeling. So then there's a lot of fear of losing loved ones, and then fear of being abandoned. All these feelings are there. Then next slide please. There's one more slide, doctor. Okay, all right. So then there was, the clients, generally they report with anxiety symptoms. They have a lot of panic attacks, and then they have restlessness. They're constantly worried about their future, their health concerns. They're all the time, they're thinking, overthinking, that cycle of overthinking is not disrupted. And with all of that, sometimes they also report with multiple panic attacks, So all these anxiety symptoms are very common presentations with people, during COVID times. And they also report with, poor sleep hygiene. They're not able to fall asleep, or they're having difficulty maintaining sleep, or they have disrupted sleep throughout the night because they're constantly thinking about something. There are a lot of stressors, for example, about their job, about their finances, and about family members, health concerns, all of these. So then there is lack of routine, and this poor sleep hygiene is also there. Next slide please. So then you see, when there were times when people, now it's not there, but initially during the first and second wave, when somebody tested positive, so the government authorities used to come, and they used to put out a poster for a quarantine of 14 days or something. And then in the society or where people are living, everybody would become, they would not like to go near that house. Or all the people were helpful also, but a lot of people, they couldn't, the movement was restricted. So isolation also works in a negative way. It psychologically impacts the person's mental health. See, even in like children who are in school, and the teacher has to give some sort of punishment to the child. So generally बच्चों को क्या बोलते हैं, क्लास के बाहर जाके खड़े हो जाओ. So man is a social animal. तो क्लास के बाहर जाके खड़े हो जाओ से है कि they are उनको सबसे सोशली अलग कर दिया है. या इवन विद अडल्ट्स जो क्राइम करते हैं, उनको जो प्रिजन में इम्प्रिजनमेंट की पनिशमेंट दी जाती है, सो दिस आइसोलेट कर देते हैं उनको, है ना. सो यहाँ पे क्या हुआ, कोविड में सेल्फ इम्पोज्ड आइसोलेशन था, बिकॉज ऑफ द वायरस, ऑफ कोर्स, सो उसमें ये जब प्रोलॉन्ग हो गया ये सेल्फ इम्पोज्ड आइसोलेशन, सो देन इट स्टार्टेड टू wreak havoc on mental health, because then so people, they were not able to interact with other people, and social जो touch होता है, communication होता है, वो सब कम हो गया. So eventually it started to affect mentally in various forms, which I'll just discuss. Next slide please. Okay, so see, even when after a long period of isolation, or even after these lockdowns were lifted and things became almost nearly normal between the waves, and people were asked to report back to work, whether in person in offices or online, so then they started to have social anxiety, because then they felt that itne lambe times ke liye they had less of social interaction. So there were times when jab wo wapas gaye apne kaam mein, to unko social anxiety hone lagi. They had feelings that they'll be judged, and they started to feel embarrassed about of a lot of situations. For example, people who had become positive earlier, and their colleagues who were not positive, so they were being judged that you must have not taken care, probably you were careless or something, that is why you contracted COVID. They were layman language में ये सब चीजें लोगों ने face करी. So they were humiliated, and so all of this tended to cause social anxiety in people. Next slide please. Next slide please. All right. So then eventually, there were people who also started to have depressive symptoms, like, they didn't find it interesting to continue doing things in which they earlier used to find pleasure in. So like they're doing their routine activities, or they're avoiding people, not wanting to be with anyone. Appetite was, either decreased or increased. There were appetite changes, and the entire day would be dull and gloomy. They would not talk to anyone, not engage in things. There was procrastination. They would delay things as much as possible. So gradually these are the symptoms when depression starts to set in. Next slide please. Then the mostly housewives, the ones who were working who were staying back at home and taking care of the children, the family members, elderlies, the people who were working from home, and they were on their online meetings and all. So usually the wives who were not working, they were supporting all of this. And at that time there was you see, domestic help was not coming because of the lockdowns, and because people were scared of keeping help. So they were trying to do majority of the work on their own. So eventually, after a long period of time, they started to have burnout. So burnout is that for a long period they were doing physical chores and everything, and mentally it started to impact them, because entire day they would be tired, and they had things on their mind that this is left, that is left, the work is not yet done, the next day there is deadline for the children, they have to be careful for their school, online schooling. So they started to have burnout. Okay. Next slide please. Then with children, they had online schools, and parents who were also working from school from home at that time. So they had to juggle between managing their own online class meetings, and online school for the children. And after the work, they had to take care of their homework, they had to take care of the household chores. So there was a lot of things which was piling up. So for children also, there was no fun activities, no fun time. They could not go out and meet with other children. Even at home, the atmosphere was all the time like they were working, and there was no relaxation time. So children, they were affected a lot because of all this, and they also had mental I would say that they became rebellious. They did not like the school, online system of schooling, online system of giving exams. So they did not like all of that. So that was also a major challenge for parents, how to overcome that. And next slide please. With elderlies also, you see, when all of this situation was happening, so the elderly people, see, they're majorly dependent on their children for for their daily chores, and for they're financially also dependent on them. And with old age also comes uncertainty about life, so they have to be largely dependent on their children. So with this kind of situation, when they saw that everybody was busy doing work, and nobody had time to relax, so it impacted the elderly also. They also had geriatric depression, like Dr. Rakshana also mentioned that during the pandemic, she witnessed a lot of geriatric patients who came in for depressive symptoms and anxiety. So geriatric depression and anxiety also showed up during this time because of the uncertainty and fear of death. So this was also seen. Next slide, please. Also, when this first and second wave was happening, and because of COVID, people were were told to go back to their hometowns, and they were told to work from home. So there was a lot of relocation that was happening. So that was a major stress of a lot of people. So you see, there are few stressors which are considered to be major stressors, which also account for adjustment disorders. Eventually, like marriage is one, change of place is one, change of job is one, losing a job is one. So these kind of stressors. So of course, relocation and uncertainty about their jobs, whether in future they would be whether they would be kept in the job, or whether they would be asked to leave. So all of this also led to adjustment disorder. Next slide, please. And there were multiple other stressors also, like loss of independence and freedom. There were uncertainty about the future, and social life was came to an end, and relationships were there were a lot of relationship problems that people were facing, like there were long distance relationship problems, and a lot of problems of this sort came up. So these were the a lot of stressors which contributed to the various mental disorders. Next slide, please. See, and there was acute. See, so in COVID times, like for example, if some family member contracted COVID, or there was a loss, somebody lost their job, or somebody died because of COVID. So the family members, this is a kind of acute stress for them, stressful situation, traumatic event for them. So they had a lot of acute stress reaction, immediate reaction response to the traumatic event, and they had a lot of multiple somatic symptoms like dizziness, headache, diarrhea, palpitations, and a lot of these kind of things. So acute stress reaction was seen a lot at that point of time. Next slide, please. Now, also there was a lot of grief which was seen. So grief is something like after losing a loved one. So grief is most of the times it is considered as a normal reaction. But because in COVID, there were like children are in different countries, and they lost their parents who were back in India or other countries, and they could not come in at the time of funeral or cremation or things like that. They could not come at the time to take care of their health. So it turned out that eventually the grief had various complications, like there was complicated grief, and there were various kind of different abnormal grief reactions which were there. So that was like children who had lost their parents, and they were left abandoned, and they lost their grandparents. So there were a lot of scenarios in which the grief was complicated. It was not a normal kind of a grief reaction. Next slide, please. Then also we saw that during such times there was maladaptive coping, and people indulged in a lot of substance abuse, because there was boredom. When they were restricted to their homes, and there was no activity, there was no social interaction, there was no way of for their recreation and things like that. So out of boredom, they needed a mental stimulation. So to distract themselves, to dissociate themselves from that scenario, they went into abnormal maladaptive coping strategies, and that led to a lot of disorders. Like there was a lot of substance abuse. Next slide, please. There were a lot of gaming and gaming disorders and internet addiction, because that gave instant gratification to the people. They enjoyed it. So it like a reward circuit. It became an addiction for them. Next slide, please. And then there were eating disorders, because in this pandemic, like there was like we mentioned at the beginning, that there was fear of uncertainty, fear of death, and fear, uncertainty about life, and everything was at stake. So subconsciously people went into survival modes. So survival modes, the immediate comforting thing is like if you go back to a jungle law, that mammals were uncertain when they would get the next meal. So whenever they would see, they would get some meal, they would eat it, to restore energy. So similarly, subconsciously in this survival mode, people started to have eating disorders. They started to have binge eating, and the multiple various other eating disorders were noticed. Next slide, please. Then we also saw that there were lack of healthy habits, and it led to compulsive behaviors. There were a lot of people who already had OCD, and that had aggravated. And apart from that also, because of COVID-19, the surface disinfectant and contamination and all of that, it increased the compulsive behaviors. People started to wash their hands repetitively, and they started to use the disinfectants. There were these cases, people who had OCD, they went into so much of hand washing that they had skin problems ultimately. And I remember I had a case. This lady reported to me online that every time she would go down and buy vegetables and come back home, she would actually wash the notes, the rupee notes. She would actually wash them in Dettol, and then she would iron them, because she thought that that would be a source of contamination. So these kind of behaviors were seen. These OCD kind of issues came up a lot. Next slide, please. All right, so now because of the time restriction, we'll just hurry up and come to the management part. Although I'm sure Dr. Rachna would explain in a lot of detail, but I will just give a brief outline. So already you see the government did. Next slide, please. The government already did a lot regarding the problem-solving approach. I will only focus on the emotional hygiene part. Emotional management part. But the other things government already did, like there was largest vaccination drive. They had this Arogya Setu app, and then there was Ministry of Ayush who had they encouraged using kada and herbs and all of these things. And then there were free teleconsultation clinics which were set up for free, for people to reach out for help, for online services, e-Sanjeevani OPDs. So maladaptive coping, what happened usually, the emotional part that I was discussing, that whenever people went through negative feelings, like they had depression, they had numbness, anxiety or panic or any sort of that feeling. So they see there are two ways of coping to a stressful situation. Either we can positively accept it or negatively. So rather than going into positive acceptance, people started to go into negative coping mechanisms. Like they started to dissociate themselves and went into addictions and things like that, alcohol and all of that. They went into blaming, and then they had the emotional range went haywire. Either they had rage or too much of anger, or those kind of feelings started to come up. So it is always advisable that we have to convert these maladaptive negative coping skills into healthy coping skills, where we can we are more focused toward problem solving and accepting what is going on, identify our own feelings. Next slide, please. So like I was discussing about problem focused coping. So in usually that the problem, we ask the client to break the problem into small steps and focus at one point at one part at a time. But generally what happens, like we mentioned in the negative coping skills, people start to catastrophize, that's a negative coping mechanism. And then they think that everything is going wrong, or they would end up having, I'm just giving few random examples. For example, black and white thinking, and these kind of things start to happen. So we usually tell them to break the problem into smaller parts and try and look for solutions. So that way they are emotional way, using their emotions, they're more focused into using their cognitive mind. So that means they try and look towards the solutions. Next slide, please. So if you tell them that, if they're having a panic attack, or if they're having depressive symptoms or anything of that sort, so we usually tell them that to accept the situation and acknowledge their emotions, acknowledge their feelings. A lot of times, if you ask the client that, how are you feeling? They would not be able to tell you in words how they're feeling. So we have to, this is an emotional wheel. So we ask them to look at the wheel. There are 3 circles, innermost, middle and outermost. So first they have to identify the innermost circle. There can be more than one emotion also that they can have at a time to a given specific event or a situation. And then in that range, they have to see that what other emotions or feelings that they are having, that they can write it down on a paper. And from 0 to 10, we give them a range of that emotion, that 0 being minimum and 10 being maximum. Try and identify what is the range of emotion that you're having, So this is one way how they can identify their emotions and understand and accept what they're going through, and that is normal. Next slide, please. So we also tell them that they can download a lot of mood log app, that's like mood tracker on their mobiles or their devices or screens. And then what usually it does is that they can keep logging their moods to any specific situations every day, and end of a week or something, then we can find out what is the maximum emotion that they're having throughout the week, whether they're angry most of the times, or they're depressed, or they have panic, So this helps us identify all of that. Next slide, please. We also advise them to do journaling. We ask them to write down about what is bothering them, and how they can, what is the problem that they're facing, and how they think that they can come out of it, or whether they think that they cannot come out of it. So this is one way, journaling. Next slide, please. Grounding techniques. So usually when a client is having overwhelming emotions, we tell them, assuming of any situation or going through a traumatic event, we usually tell them that to ground themselves. So that is like 5 things that they can see, 4 things that they can hear, 3 things that they can smell, 2 things that they can taste, and any 1 thing that they can touch. So it brings them back into that moment, and it immediately helps them activate their parasympathetic system, and it helps them reduce their anxiety. Next slide, please. We also tell them for breathing exercises, so generally it's the box breathing. So exhale should be longer than inhale. So it is also seen that, a lot of people who have acute panic attacks, or if you may have seen during the flights, paper bag breathing is also advised, So when you're breathing for 2 or 3 minutes, and then you into the carbon dioxide, so, it kind of lowers down your parasympathetic system. And again, it helps you, calm down with your anxiety. Next slide, please. So like we mentioned that, people had, because there was no routine, there was lack of routine. People did not have, because all the time they were at home, they did not have to get up at a specific time, get ready, go out. And, nobody was going to school, nobody was going to office. So all the entire day they were at home doing meetings. So there was no schedule, So because of that, the sleep was disrupted, So a lot of people had difficulty falling asleep. So we always tell them that, follow good sleep hygiene, which includes that, they must not have caffeine or alcohol in the late evening. They should not do vigorous exercises. They should limit their screen time, because it emits blue light. And then I have a video on YouTube regarding sleep, so I can share the link for that also. And so we tell them, that the 6-7 points for sleep hygiene, and it helps a lot. Next slide, please. So we also tell them about relaxation exercises. So there's this JPMR, Jacobs Progressive Muscle Relaxation Technique, in which we usually tell them that lie down on your bed, and switch off the lights, and be calm, and try and from your distal end, try and squeeze your thigh muscles, and then your calf muscles, and then your abdominal muscles, and squeeze your teeth, clench your fist, things like that, and then maintain it for a few seconds, and then you gradually release them in the same way. So when they're doing that over a period of like 5 minutes for repeatedly, one after another, so it helps them calm down. It also helps them fall asleep faster. And so I think I have already taken a lot of time, more than 20 minutes. I'm sorry, Dr. Ravi.
No, Dr. Rathika, I think this was absolutely fantastic. You brought some very important points to the forefront. I think this was a very good comprehensive overview of what most of us were facing in the pandemic, right?
Right.
They say that, when the first pandemic happened, everybody had become a chef at home. And when the second pandemic happened, everybody was running around with extremely high emotions, with a lot of stress, with a lot of mental trauma. I think this was very good, Dr. Rathika. I think we leave the discussion part for the second part, but now let's hear from Dr. Rakshana Khanna Singh, who's a very senior psychologist with Artemis Hospital and has a clinic in M Block GK1. Let's hear from her what she has to say.
Thank you so much, Dr. Sameer and Dr. Rathika. That was a wonderful presentation. I think you put it very beautifully, comprehensively together. I'll try to, there are obviously some overlap points, but I'll try to, leave those and try to stick to something which is a little different and newer. So if I may just have the presentation.
Dr. Ravi, if you can just get the presentation on. And in the meantime, if all the delegates who joined us, please feel free to flood the question box and send your comments in, and then we'll address that in the end when we have a discussion.
Thank you so very much, Dr. Ravi, for the slides. You could just have the first slide on slideshow. So I'm going to be talking a little bit about positive mental health and how are we going to manage this. So of course, Dr. Ratika did bring into light some of the current concerns, and specifically so in the last 2 years, how we as a population, how we as individuals have changed, how our mental health has altered, and how mental health has become a priority currently. So next slide, please. So I just want all of you to have a quick look at these stats. Next slide, please. Yeah, thank you. So if these are stats by the WHO, which talk about 1 in every 4 people suffering from some mental health concern or the other. And these are stats taken pre-pandemic. And of course, there are a lot of psychologists, mental health experts, psychiatrists who are now mapping, and we're seeing that this doesn't look like 1 in 4 anymore. This looks more like 1 in 3 or 1 in 2 people having some mental health concern or the other ever since the pandemic struck us. So that literally means every second person sitting here has been grappling with something on the mental health front. Next, please. So have a quick look at this. You can see these are a little bit of gory statistics here. My purpose is not to frighten anybody, but my purpose is to bring to the forefront that, if we are to treat mental health concerns, we would be not looking at these kind of gory statistics at all. So you see, over 80% of people with depression did not receive any specific treatment for their depression. So if they had received treatment, we would be not looking at something like this at all. And in fact, we have some really terrible figures of 1 suicide every hour by a student in India. And I'm really hoping that, with mental health becoming a priority now, with organizations like yours, esteemed colleges, esteemed so many other corporate sector, they're bringing forward, and we having awareness conversations like these, which will effectively help all of us as a population. And we are going to aim to bring this down to, I hope, not even 1 suicide a month. Next, please. So, today we all are sitting here discussing about health, mental health, wellness. Well, it is the need of the hour. And, we would all agree that maybe none of our parents would have ever sat through a webinar, or forget a webinar, also even attended a seminar a generation or 2 prior, where we were discussing all of this. That's because today it's the prime need of the hour. And, we are looking at, we've always been talking about mind, body, and spirit or soul to maximize the potential of a person to lead an absolute holistic and productive life. Next, please. But we're not talking just about these 3 aspects anymore. We're talking about 6 dimensions of wellness, where we talk about emotional, intellectual, physical, social, spiritual, and environmental. So have a look at all of this. So if we are not well in most of these aspects, we are not going to be well with ourselves. And we need all of these together in conjunction to feel good and to be a holistic, well-developed person. And, I shall share a video later, since this is, we have, short time, but I'll share it to the esteemed panel, and, maybe they can mail it across, which is a video I did for the UAE, for all the airports it was running, which talks about all the 6 dimensions of wellness. Okay, so next, please. So this is a beautiful picture of a woman which has already a caption saying stress. So, I would want us all in the next 10-15 minutes that I have with all of you to interact a little bit and keep typing in, so that we can be, interactive. The more interactive we are going to be, the more fruit we are going to get out of this presentation. And it's more a workshop style where we can all converse and interact with each other. And that's the way it's a journey. The presentation itself is, these are eye openers, where if we take something back from it and make some changes in our lives, then we're, at least our job as mental health experts is done, So what do you think? This goes to everybody. What do you think is causing stress for this woman over here? So the caption says stress. May I have the next slide as well? So I, of course, didn't want to be gender biased. So there's a man also over here with the caption saying stress. So in one word, what do you think is creating stress for these people in the picture? Anybody would like to type in, and just please feel free. I can't see the chat if anybody's typing in.
Well, to begin with, I can give one suggestion. That would be a deadline.
Okay, so Suman says overburden. Dr. Vivek says too much work. Dr. Sameer is saying deadlines. Okay, anybody, let's come up with one word which I puts this together. That why are these people having stress? So actually, the one, absolutely. Thanks, Anupam. The one word is multitasking, and that is what is creating stress for these people here. So, quick question to all of you: how many tasks do you think our mind or brain can do at any given point of time without feeling stressed? How many tasks? Take a guess. 3. Vivek is saying. Just type in 1, Anupam. 2, Basant. 4, Dr. Ratika. We know that all of us are doing way more than 3 to 4 tasks at any given point of time. And that is why our mind feels very stressed and overburdened most of the time. So, looking at a screen, thinking of something, what I'm going to do at night, what am I going to have for dinner, what presentation do I need to do? I have this patient lined up. What do I need to do? What do I need to buy? And then the phones are buzzing, and then, you have something going on the computer. So actually what is the permissible limit is just 2. That is the permissible limit. But because we do way more than that, that is why we feel stressed most of the time. Let's go to the next slide, please. Okay, so
the slideshow is not there.
Thank you, Dr. Ravi. Yeah, so the next one, please. So then the next one, please?
Can you see the slide?
No, Dr. Ravi, I can just see the picture of the man. If you could just push it to the next one, that would be nice. Okay,
Ravi,
so
Ravi, take it to the slideshow, please.
Yeah, just go back, Dr. Ravi. If you just go back a little, Dr. Ravi. Yeah, I think. Okay, while Dr. Ravi is getting at the slides, and we all don't need to feel stressed because the slides are not showing as they should, but that's okay. So what really is stress? So stress is nothing but the physiological and the psychological response of the body to a situation, it seems, which it seems that it is harmful to it. It seems which is perceives it to be harmful. Next, please. Okay, so while the slides are coming on, let us understand what is it that we feel when we are stressed. So, we can only reach to a solution where I'm very well aware of what the problem is. So I like to first define the problem first to understand what is it that the problem is. When we understand what it is, then we are able to find the management strategies also. Yes, thank you, Dr. Ravi. So let's start typing in. I understand that we have a lot of colleagues here and a lot of people who we know each other, but whatever possible in your permissible limits, please type. Thank you, Mr. Somnath, saying overwhelmed. So each one of us at any given point of time do feel stressed. ऐसा कोई इंसान नहीं है जिसने कभी भी तनाव महसूस नहीं किया हो. In fact, एक दिन में बहुत बार हमारे तनाव के स्तर ऊपर नीचे जाते हैं. Stress, tension is a common word which we use on a daily basis. So what is it that you feel? Because I need all of you to understand what is it that you feel before we go on to the solution. So overwhelmed, too much is something what I think Mr. Somnath said. Anyone else? Okay, out of the world, helpless, Dr. Ratika. Someone said tension, nervousness. Thank you for sharing. Feeling anxious, Vinita. Thank you. Depression. Okay. So everybody feels this. Irritated. Rashmi saying. Someone saying want to be alone. Sanjana says lost to thoughts. Okay, so I want everybody to either put it down on a pen and paper, not able to take decisions. Thank you so much, Vinita. So everybody must write down, even if you can't share with us here, you must write down what is it that you feel when you are stressed. Let's go to the next slide. So I have divided this into buckets for everybody. Tired. So if you see, I've just made it for everybody's ease that these are different responses to stress. So the emotional symptoms could be irritability, anger, गुस्सा आना, चिड़चिड़ाहट होना, डर लगना, रोने का मन करना, sadness. These are all symptoms which are emotional. Next, please. Then we have the cognitive symptoms, which are the symptoms of the mind. So difficulty in concentration, not able to decide, brooding patterns. Next, please. Then other somatic symptoms, I've divided this into. So soma means the body, and that's why you hear a lot of times when people say that illnesses are psychosomatic, they're originating from the psycho and the soma together. So disturbances in sleep, sometimes when the stress levels are very high, very commonly we'll either sleep too much or just won't get sleep. Appetite gets very high or very less. And a very common example is that I recall when we used to have board examinations, and when you would meet your friends after a couple of months of pre-board break to the board examination center, you would see some kids had lost weight and some people had gained weight. That's because some people under stress would eat bags of chips and biscuits, and some people would just lose appetite. Difficulty in digestion, loss or gain of weight, aches and pains is extremely common. Fatigue, palpitations, all these account for the somatic symptoms. Next, please. Behavioral symptoms would be, reduced performance, impaired motivation. This is something I think we have, our OPDs are literally flooded in by people saying, specifically after the, second wave has happened, there has been a lot of disturbance and a lot of people coming and saying that, what they don't feel like is they don't feel motivated in the morning. They're not feeling depressed because by now we've started to understand the difference between depression and demotivation. So you get up in the morning and just don't feel like doing anything. The stimulation is not that high. So now we're talking about, and this feeling, by the way, which is a feeling a lot of people are trying to identify, is a feeling called languishing, where we just don't feel like doing anything much. And now what we're talking about is how are we going to convert languishing to flourishing? Anyway, coming back to the behavioral symptoms, increased, absenteeism at work, in school, in classes, not being able to reach to office, increase in usage of substances, which even Dr. Ratika talked about, caffeine, smoking, alcohol, and many other things. Next, please. And of course, this has been hugely a time with a lot of crisis for all of us in the last 2 years. And as a population, how even Dr. Sameer was saying that, we behaved differently. In the first pandemic, we took it with the first wave, we took it in a stride, and we thought we were going to, take it as a positive challenge. And, we kind of broke through with it, with, reaching out to people all over the world. People were playing games, becoming the best chef possible, reaching out to, newer hobbies, and, doing so many things. And the same thing became extremely distressful in the second wave. And now what is happening to us and our mind is that we started to feel very disappointed. And we've also started to feel very constricted because we're now seeing that, we are only able to operate literally in bundles, where suddenly there is, a lockdown, then suddenly there's hybrid work. So it is becoming difficult for us to maneuver ourselves through. So what I have done again is, for everybody's ease, you could put this down for your own self as an exercise for your own self. You could, break this into a little bit of the areas of impacted. Next, please. The areas which life has got impacted during COVID. And you could put down which are the areas your concerns are lying. So self, couple, parenting, elderly, and work-life balance. Next, please. So of course, throughout the last 2.5 years, we've been, dealing with a lot of anxiety, hopelessness, erratic schedules, constriction, feeling a lot of fear. Fear is something which looms even now, and we're learning to deal with it. Frustration, anger, a lot of negative thinking, overthinking. Next, please. And we saw that this was been an extremely hard time on couples at some places. Why should I even say couples? Even all relationships, because wherever the bonds of relationships were weak, whether it was sibling relationship, parent-child relationship, all the dormant issues started to come up when we were all locked down together. And, there was a lack of patience, increase, personal frustrations were there. And of course, we saw that, where initially we were enjoying the first wave sitting home together, we'd never sat home together, never eaten unending lunches with each other together. The same thing after 2 or 3 months started irking us. And unfortunately, by end of 2020, we saw an enormous rise of the number of cases of divorce being filed in and a rise in domestic violence as well. Next, please. Parenting, of course, it's been a big challenge. Little kids on Zoom calls, kids and even adults waking up straight from their bed, rolling into a Zoom call. It's been a big challenge for working parents. We have people constantly, talking and cribbing about this, mothers cribbing about this, that we have 1 year on their, office work and the other year on the children's work. And of course, children where, for us, I would say for adults, it's been 2 years, gone here or there. But if you really see, a lot of kids have had milestone years. I have a little nephew who joined school in the COVID times and thinks the screen is school. I mean, that is it a bit so sad. And then we see kids who never, even reached the 12th standard. They never went to school at all, and they just graduated to college. And we've seen, kids who went to college in 2020, they've had such a compromised university experience. They haven't seen the face of university. So it's, of course, the peer group interaction is largely affected, and the personality development is affected even more. Next, please. A huge amount of insecurity everywhere. Elderly, of course, knowing that they are the most vulnerable section of the society, a lot of fear. And one of the largest things they've dealt with is loneliness, anxiety. And I think this is a question I've got in almost every single webinar, which I'd like to address now beforehand only. I think in the pandemic itself, I would have done over 100 webinars with a lot of institutions from the IIMs, IITs, a huge number of corporate sector as well. I think what I keep getting asked is that how can we help the elderly around us? Well, the first thing is to understand that they are not that tech savvy. So I think making them tech enabled can really, really, bring the juice back into their life. And, enabling them for video conversations, other conversations with their peer group, with their family members, cousins, relatives is very, very important. Next, please. And this is something we always laugh at, that we don't know when we are working from home, what are we wearing pajamas and working and you're just dressed differently on the top. But well, that's not true. Coming next, please. So coming on seeing the impact of mental health on a survey, which is a very large survey done by Everett in 2020, 130,000 participants, stating that high workloads, extended hours, changing working patterns, work-life balance became a big struggle, prolonged stress, anxiety, and burnout. Next, please. And of course, these are the losses we have experienced and are experiencing. Exactly what Dr. Ratika was also sharing: loss of relationship, control, a loss of income, freedom, independence is, I think, what we have really lost on. Next, please. And now I'm going to come to see the brighter side of things with how are we going to manage. So far we talked about what is stress, what are the symptoms, and now we're going to talk about the management. Next, please. So like I said, I use an ABC strategy mostly everywhere, saying that A is the awareness, B is the balance, and then C becomes the control. Next, please. So A, the awareness, what causes you stress, how do you react is what we did earlier. Next, please. So to create and find a fine balance between the positive and the negative, because all stress is not bad. The bad stress is the distress, the good stress is the EU stress, which is very, very important for us to perform. If I didn't have stress, if we didn't have positive stress, we would not be having this presentation. We would not be reaching anywhere on time. Kids won't be going to school. We won't be going to offices and clinics. Next, please. And see the control. How are we going to cope? How are we going to combat? Next, please. Next, please. So some of the few important strategies and techniques we look at is changing our thinking, changing our behavior, and changing our lifestyle. So when I talk about changing your thinking, this is something very frequently which we address in the newspapers also. As I was sharing earlier that I do the weekly column for Times of India. Very often we keep getting this question that, although every morning I get a WhatsApp message saying think positively, I hear people saying think positively, I read thinking positively, but how do I actually start to think positively? Well, the answer is very simple. Very, very important. We need to train our mind. It is not going to happen as if by magic. So similarly, for example, if I decide that I want to lose 5 kgs of weight, I put in a positive intention, but just by sitting on this chair, I'm certainly not going to lose 5 kgs of weight. I'll have to make some effort. Kuch mehnat karni padegi. I may have to go to a gym. I may need to start walking. I may need to cut down my sweets and so on and so forth. Similarly, so when I decide that I'm going to start thinking positively, we need to understand that mostly what we are flooded in is usually with a lot of negative thoughts, negative automated thoughts. But I have to make an effort to convert them into positive thinking and positive thoughts. I do need to put in a positive intention that here is what I'm going to start working with, and then start working at it actively. And always remember, if our thoughts are positive, then our speech will be also positive. Our speech is positive, we will be having positive actions, and I will be then attracting positive people, positive situations, and positive circumstances in my life. And on the contrary, if I'm constantly thinking negative, kya hoga, kaise hoga, ye theek jayega, mere marks theek aayenge, will I be able to present properly? If I'm constantly thinking negative, my speech is also going to be negative. My speech is negative, my actions are going to be negative, and I'm going to attract negative things, negative situations, and negative circumstances in my life. So if we need to think, we need to understand, we need to break this cycle. Next, please. So changing our lifestyle, diet. For smoking, yes, we're saying that, have 3 meals a day with 2 small meals interspersed. We all understand that this popular saying, which is breakfast like a king and dinner like a pauper. But of course, in Indian families, we do the reverse because we're sitting and eating a lot at night, and we really need to change that habit. Smoking is a no-no, alcohol in moderation, exercise, and good quality of sleep, which Dr. Ratika discussed, the sleep hygiene also, that, making sure that you have a good sleep hygiene, some amount of time for leisure and relaxation. Next, please. So I'm going to sum this all up to say that, how are we going to stay positive in today's time? Fixing a schedule. So please make sure we have a regular sleep and regular meal pattern, which I think most of us lost in the pandemic, where we didn't know, we were binge watching, we were sleeping late, and obviously so we were not feeling fresh the next day. The mind wasn't working to the optimum. And we do understand that, we need to cut away screen time at least an hour before we sleep. Otherwise, the melatonin doesn't get released properly, which is because if you're not following the circadian rhythm or the biological body clock, the screen time, the blue light, it really interferes. Physical exercise, we need physical exercise. There is no debate about it at all. So 45 minutes to an hour of good physical exercise daily. We know that it releases the positive hormones, the endorphins. 10 minutes of breathing daily. We can't now substitute a pranayam for anything, of course, besides making sure that our lungs stay very healthy. It also activates the thymus gland, which releases the immunity cells, which are your lymphocytes, and it also aligns your nervous system. So a lot of positive hormones are also liberated, and we also have a great mind-body discipline if we are able to do 10 minutes of breathing exercises daily, and 10 minutes of any simple positive, mindfulness techniques are beautifully, can help you beautifully to, take your day through. So all I'm saying is an hour, 15 to an hour and a half on your mind and body every day, 45 minutes to an hour of active exercise, 10 to 15 minutes of breathing, and 10 to 15 minutes of mindfulness. And of course, indulging in positive activities, so research shows us that if we were to spend 2 hours a week on our hobby, it is known to bring down the stress levels tremendously. So, do pull out that old guitar, chessboard, which has been lying forever, and start doing that actively, whether it's music, reading, writing, and some amount of daily prayers, chanting, grounding exercises help us deeply to ground ourselves. And, we can stay rooted, which doesn't let us sway with a lot of external stimuli. And understanding that all of us have been through a difficult time and a lot of us are still grappling with it. And we are not the only one who's alone if you've been feeling out of sorts. So make sure that you have a good, next please, having a good support structure of friends and family. Even if you have, earlier we were saying 5 people, now we're saying even if you have 3 people who you can reach out to at any given point of time, make sure you have a support structure of at least 3. You should feel absolutely blessed. And like I said, we're talking about how are we going to move to flourishing in our lives in these difficult times. One of the best ways is to maintain a gratitude journal. So every evening before sleeping, writing down 5-8 things which you have felt grateful for in the day. It could be something as small as, getting your favorite dish on the table or somebody giving you a compliment. So this is something which will keep us going, and it is known to liberate a lot of positive hormones. And next, please. And like I was talking about positive statements, positive thoughts, we need to now convert and rewire our language rather than saying, kya hoga, kaise hoga, kab karenge, will it be okay? We need to convert our language to I am well, I am free of all fears, I am full of joy and happiness. These are few things that we need to start speaking. And once we speak in a positive way, trust me, a lot of positive things will happen around you. So next, please. So we have an app by the name of the Mind and Wellness app. It's only available on the Android version. It's completely free of cost. You could download it. It's got some brilliant information about mental health, all under one roof. Next, please. And right in the pandemic, I came out with a book, Bloomsbury, which is the Harry Potter people, asked me to pen something down. And now this is known as the First Aid Mental Health Kit. It's available on Amazon. It's a simple book called Stress Diaries. It's a great book to have on your shelves or on your table. So it's now, if you're feeling low, you're feeling down, or you're feeling anxious, there's some brilliant small little exercises, small things you can do, paper pen exercises and things like that, or other breathing techniques which you can just pick up and do right there and then. And of course, if you feel that you're not feeling well consistently, please do not hesitate to reach out to a mental health expert. The good part is that now everybody is available literally at the drop of a button. So thank you all for listening in, and I hope I maintained the time, Dr. Ravi, because I know we were crossing over. So thank you so much. And yes, we're all here to answer anything you have to ask.
No, I think this was excellent, Dr. Rakshana. I think there were some such important points you brought up about maintaining the gratitude journal, about getting positive thoughts, and and that attracts positivity around you, and so many other tips that you gave, and some important, very valuable things that I think we can all incorporate. All of us, even those people who are not having any mental illness, so to say, can also incorporate in their personal lives for better living. One important thing which I think both of you highlighted was the children, how the mental attitude of children is getting severely affected in the pandemic with homeschooling. And not long ago, I was talking to a friend of mine who has a 3-year-old and said, for the first 1 year of his life, he had no idea what to do. He was just a small baby, and then 2 years there was a pandemic, so he's not really had much in terms of interaction with the outside world. Recently, his nephew came along, and who was in the US, and the two of them were playing, and he ended up bullying the other guy, the little one. And he said, that's probably because my little one has had zero interaction with the outside world. इसने कभी बच्चों के साथ खेला ही नहीं है, वो तो घर पे ही पड़ा हुआ है 2 साल से because of COVID. So I think these small development things, what you talked about, the elderly, how they are getting affected, both of you really highlighted that. Some very valuable and important lessons for all of us. Like I was telling you, that the way I perceived the two different, the first wave and the second wave, was a little bit different. The first wave, everyone was a chef, and in the second wave, we were all struggling to maintain sanity. And I think domestic abuse also went up a lot in the second wave, and in the third wave, in the first wave, domestic abuse, child abuse, alcohol abuse went up. A lot of my patients came. I've had distinctly two different types of patients who come in. One who have had a lot of alcohol and have smoked like a chimney, and their health has gone for a toss. And there was this other group of people who actually took the pandemic in a very positive way. That they're like, I quit smoking. They're like, first day of lockdown, I couldn't find cigarettes anymore because all the punch outs were closed, and I quit smoking. And I joined the gym, and I wrote a book, and now I meditate every day. So there are two different types of people with two different outlooks that have come across very clearly in the pandemic. But I think there are a lot of questions which are coming along. Mr. Siegel, if you want to start taking the questions. I have to leave for a medical, I have a case, so I have to leave. But yeah.
Sure, Dr. Sameer, definitely. I totally understand. And I think let me just hit on the Q&A box first. There is a question from, if I get it right, Vasni Sahu. And it's an English question. So I just read it out. What about a person who suddenly gets aggressive when he heard something not according to us, and if we argue, then मारता है, फिर वही इंसान care भी करता है, suddenly changed and start to care about you? If we can say he's mentally disturbed, and what is the solution of it? So shall I put it across to Dr. Rakshana? You'll have to unmute yourself, please.
Sorry, could you come again on the question, please?
Okay.
I lost a little bit.
All right. So it's in the Q&A box from Vasni Sahu. And she says, what about a person who suddenly gets aggressive when he heard something not according to us? And if we argue, then मारता है, फिर वही इंसान care भी करता है, suddenly changed and starts to care about you, ... If we can say he's mentally disturbed, and what is the solution of it?
So yes, certainly there could be, some levels of personal frustration leading to this, but we could be looking at, only when a mental health expert sees the person, we could be looking at some sort of bipolarity also, but can't say for sure until someone does speak to either one of the family members or the person in place, because it seems to be, there seems to be two sides to it. So this certainly needs to be addressed in a closed way to the particular person in space.
Okay, so it means they do need some medical advice.
They certainly need help, and they need to speak to a doctor, and they need to understand what is going on and explain, in details. Of course, we can't do it in an open audience. So.
Right. I'll just take an extension of this question and
Sure.
Try to get Dr. Ratika in for this. See, there is, I don't think how many of us know about it, but then I do a little bit, that there is a psychiatrist and there's a psychologist. So a lot of us do not know what's the difference between the two, and can we just choose a psychiatrist or a psychologist and just go to them in case, for example, there's a case in point which we are talking to, and if not, then who do we go to and what time? Dr. Ratika.
All right. Thank you for the question. So yes, both a psychiatrist and psychologist, both of them come under the umbrella of mental health, So see, psychiatrists are people who have done their MBBS, and then they have done specialization, post-graduation, and then they become doctors, and they are licensed to give medications after diagnosing a certain sort of disorder or a problem, right? And psychologists are also people who are very well, they don't have license to give medicines, but they are, talk experts. They are the ones who actually help in the longer run, because, they find out the root cause of the problem For example, if somebody is going through a lot of, so they have a lot of stressors, and they have eventually because of that, they have depressive symptoms or anxiety symptoms or things like that. But the cause of that, there's a lot of stressors. For example, somebody's had a breakup, somebody's failed, somebody's lost a loved one, or some other financial problems, or the endless list is there. So what happens is psychologists are the people who will talk them out. They will talk about their core problems, try and identify where their coping strategies are going wrong, how they can deal with those kind of difficult situations in their daily life, and how they can manage their emotional hygiene, how they can manage their emotions and keep themselves in peace. And psychiatrists are the ones who will give them medications for the clinical profile. Suppose the patient is suicidal, and or the patient is harming somebody else, or a patient has a psychotic episode where the patient has lost reality to testing and doesn't know what the person is doing. Alcohol dependence is there, and things, bipolar disorder is there, which is not in control of the patient, which can be helped with a certain limit, with the help of psychologist also, but largely would need medications, pharmacotherapy. So psychiatrists are the ones which, who will help with medications and see the clinical biological profile, whereas psychologists are the ones who will help you keep your mind in place, and which I feel in today's world, psychologists are doing much better than psychiatrists actually. Am I right, Dr. Rachna?
So we have people from all fields coming to us, not only people who are not feeling well, as you're very aware, Dr. Ratika, somebody who just wants to, I have CEOs of companies who just want to bounce off, a lot of overload, and also a lot of want to just get some guidance. So it's, translates to more like counseling or a counselor for lay people. And we also help to identify the patterns. All of us have certain patterns, how we operate in relationships or how we operate with our own selves, so the toxic patterns or the difficult patterns, we help identify, we help to break them and to revisit them. And like you said, to give better coping strategies. So, like I said, from politicians to movie stars to everybody, they just, yes, they do visit because, they just want to, of course, venting, offloading, talking, that's one aspect. Come and discussing from a more structured perspective. So in fact, while Dr. Sameer was speaking about kids, I just also wanted to bring this into the forefront that like about how we were speaking earlier, Dr. Ratika, that, so many teenage kids have been finding it such a difficult time for the last 2 years, and the number of teenage kids I have in counseling has just grown exponentially, and sadly after Sushant Singh Rajput's episode, everything came so much in the forefront, and our phones wouldn't stop buzzing, and people were like, we're not feeling well, something's happening to us, and we need help. But just want to bring this into everybody's notice that we have such a good esteemed panel here that that a lot of times parents were negating the kids, saying, हमारे ज़माने में तो किसी से बात करने की कोई ज़रूरत नहीं होती थी, हमसे बात कर लो या अपने दोस्त से बात कर लो तो ठीक हो जाओगे. But that's not what a mental health expert's job is. It's not that they just talk for the heck of it. They talk in a structured way and give you some solutions, some problem solving solutions, and also help to bring down your anxieties in a specific trained fashion. So similarly, the same goes, I would say, for relationship counseling or couple counseling also. I mean, I have besides couples who come for counseling, I have people like mothers-in-laws and daughters-in-law in counseling. I have people, so many geriatric people in counseling, so it's just a different siblings. So, pre-mediation litigation counseling, where people don't want to sit down and, they just want to solve things a little easier outside. So we just help structure and speak from an independent perspective, which is a trained perspective and a non-emotional perspective. So
thank you, Dr. Rachna, for this. And I think if it's right to say that it's good to go to a psychologist first, then end up with a psychiatrist.
So, it totally depends where somebody, sometimes the clinical concerns where you immediately need to really rush to a psychiatrist first immediately. And then they will ask you to take help with a psychologist with therapy as an adjunct therapy. Like Dr. Ratika said that, we work more long-term with a client versus a one-off giving medication. So that, we have people who are suicidal, suddenly having psychotic episodes, bipolar episodes. So these people need immediate help from a psychiatrist. And
yeah,
then
but for a layman to decide,
psychologist.
yeah, correct. So for a layman to figure out whether it's a psychologist case or whether it's a
Yeah.
psychiatrist case,
Yes.
so is it safe to say to first go to a psychologist or go and then?
So if you're, yes, you can go visit a psychologist first. And if they also feel that, it needs medication, they immediately refer you to a psychiatrist and say that, you need this alongside. And that's the true job of the practitioner. It's the true job to actually work in an adjunct fashion.
Right,
and a lot of times, even when patients come directly to psychiatrists, there are a lot of times and instances where, the psychiatrist would need more clarity on the diagnosis. So we actually refer the cases to, clinical psychologists so that they help us, for the psychodiagnostic evaluation that is called. And they have a lot of forms and tools and special ways, where they can differentiate that fine line of, when we have a little bit of confusion in the diagnosis. And it actually helps us, understand what the case is and how we're going to plan our management on that.
So considering you are experts, considering you both are experts, it's easier for you to figure out, no, I think ready for medicine, no, not ready for medicine. But when a person in the family or in friends is going through a trauma along with the concerned mentally ill person, with the stigma attached to it, in any case, there's a great hesitancy, which I also hear from people, when they say, oh, nobody wants to acknowledge the fact that they could be mentally ill. So there's a stigma attached to it. There's a family who doesn't want to accept that the child is or one of the family members is mentally ill. So with all that dilemma, they need to know quickly, where should I go?
I personally feel, it's not so important whether they should first go to a psychiatrist or to a psychologist. The little fact that, they are reaching out to a mental health expert, whoever it may be, whether it can be a social mental health worker as well, reaching out for help is what is the most important step. If they reach out, then help is available, all
so we have so many questions. I just want to make sure that we get answers for all of them. Vasni had put in another part to the question, which I just saw. It says about sadness we got when I continue talking with a person in the night. And sometime I thought suicide when I think about my future and fear to lose friends. I just want to know, what is this? Am I sick? I think that's what she says. So I think the apparent answer is, please do consult a psychologist or a psychiatrist, but do get some medical help.
Absolutely.
Immediately. That's the message. So Suman Jena wants to know, ma'am, how many hours a student have to sleep in a day? We've heard of IIM graduates. I know of a lot of IIM graduates when I used to go for their guest lectures, that we don't sleep for more than 4 hours a day throughout 2 years. So I think very valid question. So shall I throw it to Dr. Ratika?
Yes, please. Thank you. So see, how many hours, ideally, in Indian scenario, it's important that, sound sleep is what is more important. So even if the person is getting minimum 6 hours of sleep, but has a sound sleep and it's a rested sleep, that's very important. But you see, in Indian scenario, हमारे यहाँ ये culture है कि हम देर तक काम करें, सुबह जल्दी उठ के जाएं, तो हमें बहुत अच्छा वर्कोहॉलिक या हमें हम हमारे वर्क कल्चर को अच्छा माना जाएगा. ऐसे नहीं होता है. So I would suggest that, if the patient is able to fall asleep immediately and is able to maintain a sound sleep, a good rested sleep, that is what is important. So minimum of 6 hours definitely required.
Yeah, but that's required for a patient or not a patient? I mean,
I'm sorry, I'm used to saying this word patient. I mean any person.
Anyone.
Yes. Dr. Rakshana has seen, I'm sure a lot of children must be reaching out to her जो exam में सोते नहीं होंगे, so she must be,
Okay.
So basically, just a quick addition to Dr. Ratika. I think she's covered everything. Just that 6 to 8 hours is definitely needed, and I think what a lot of people in the corporate sector and a lot of people in high stress jobs or high stress student environments, what they're doing is they're also binging. So they will not sleep, 3, 4, 5, they will just sleep for 4 hours on weeknights, and then they will binge sleep, which is also not good at all. And as we all are seeing that there have been a huge rise of cardiac arrests in the late 40s, early 40s lately. We've all seen it. So why is all that happening? That's because we are misusing our bodies to some extent. We are not giving the basic requirement for our body, good air. We're not giving good sleep, the good food, good nutrition, and some me time to ourselves. If you're not going to do this, we are going to get sick. So you're definitely not going on the correct path if you're saying that you're sleeping just 4, 5 hours or 3, 4 hours a night. It's
Right.
it will start, the body will start telling somewhere or the other, and sometimes the signs just come with it like a volcano. You don't want that to happen. So don't push yourself.
Thank you, Dr. Rachna, for adding on to it. I have this quick question from Hardik Singh. This transcendental meditation is good for keep stress-free. So basically to be stress-free. The question mark, so I don't know, the answer is yes.
Yes.
Anything you'd like to add, Dr. Rachna?
So, a lot of meditation techniques are fantastic. And like I also said in my presentation, that please spare at least 10 to 15 minutes for mindfulness or simple meditative techniques. And meditation is not something so difficult at all. Nowadays, you can download a nice app and you can just listen. It's just about concentrating and focusing and, sometimes keeping your mind completely empty. Even if you just sit in a beautiful space or just listening to the birds, that can be a meditative experience also. So giving your mind and brain that 15 minutes or 10 minutes of space is what is grossly needed by all of us.
And I think there are a lot of apps also like Mindspace and Headspace.
Headspace. There are a lot of apps which you can just download free. Some of them are free of cost, and this should become a part of our daily habit now. And I think a lot of schools are encouraging children, by the way, now to keep it as a part of their daily routine.
Fine. I go to the chat box now for whatever questions I can figure out. I don't think this is the right platform for a question from Mr. Basant Kumar, because I don't think anyone knows the answer. When the COVID will be over. So, we hope soon, I think that's all we can say. What further precautions to be taken for future? So I think you should be attending one of the webinars which we've been having also, and we might have also with pulmonologists to be able to better answer that question. So, Suman Jaina again in the chat box says how to get relief from depression, overburden of work. And I think we've kind of tension, nervousness. There's a lot of good answers which were coming to the questions being raised by Dr. Rachna. So there's also a thanks to the doctors. How to avoid overthinking, ma'am? I overthink a lot. Prachi says this. I overthink a lot and create fictional scenarios, and it sometimes bring up insecurities. So she's overthinking and bringing insecurities. Nothing very abnormal. So a lot of people do that. Yeah, Dr.
It's very common. It's very common, and like I said, we have NAT, which is negative automated thoughts, usually kind of flooding into our head, and that's where our mind tends to go. So acknowledging your thoughts and naming what you're feeling is one of the ways how you can avoid overthinking. Compartmentalizing, acknowledging, naming, journaling. That is something which is very, very fantastic, which can help you avoid overthinking. Practicing some breathing techniques, mindfulness, that is again something which can help you avoid overthinking. But you need to do these things. So just what happens a lot of places I feel is, people say Yes, we understand, but they don't get themselves to doing stuff actively. So unless you do things actively, nothing's going to happen. Like I said, if you want to lose 2 kgs weight and saying, hi, I want to lose the weight, I want to lose the weight, but until I stop my sweets and the fats and until I go for a walk, it's not going to happen. So similarly, so for anything where you're wanting a relief on the mental health front also, please, besides putting a positive intention towards it, you need to do the work also. So you need to do those mindfulness techniques. You need to do the breathing exercises. You need to journal. You can be sure, rest assured that a large part will get help. And if not, then you need to seek a mental health expert.
Let me argue it out for another minute,
Sure.
Dr. Rakshana.
Cool.
It's very easy to say, do these things and things will happen, but when you start to overthink, I think it happens to anyone and everyone at one point of time or the other. So how do you stop thinking, and how do you distract yourself, or do you say, no, whatever I'm thinking is wrong? I mean, what does one do at that time?
So what happens is, see, one is that we need to see once in a while, we all overthink. But some people, then when it becomes a habit, that is what becomes disturbing. That every day I'm spending a lot of time overthinking, my entire mental energies or large portion of mental energies are diverted to that. Obviously, so I'm not going to be able to do my work properly. If all I'm doing is creating a lot of negative energy spirals around. We do things. So we give a lot of techniques like thought windows, for example, where we give a thought window and say 20 minutes ke liye, I am going to think about this. So you put like a timer and say 20 minutes, yes, I will think about it. So I need to acknowledge the thought. I need to compartmentalize it. And I need to put a finger on my emotion that I am feeling like this. Otherwise, a lot of times this is going to flush out in your system in the form of not able to sleep properly, nightmares, dreams. So it will come down if you don't address. So it is a good idea to give thought windows also.
Good. And Prachi is thanking you, and she says, gotta try them for sure.
Sure.
I think one last question, because we are late, and that's the last question in the chat box too. In the chat box. It says, it's from Sanjana, and she says, how to deal with insomnia. So, Dr. Ratika, will you like to take a shot at it?
Yes, definitely. So, see, insomnia sleeping comes under sleeping disorders category, right? And when somebody complains of not being able to fall asleep or having difficulty maintaining sleep, so we have to first take proper history and find out that what is the cause of that, and how long the person has been facing all these problems. So there's a time limit. So suppose if somebody's had a lot of coffee in the evening, and they are supposed to wake up and do their studies for the exam, so it's very natural that the person is not going to be able to fall asleep, or somebody is tensed up about the next morning presentation or something. So it's obvious that the person will not be able to fall asleep properly. But you see, when somebody has this problem for over a period of like long time, like let's just say more than 3 weeks, 4 weeks, and patient is not able to either fall asleep or does not have a sound sleep, what are the causes? Whether the patient has any organic like bodily symptoms because of which it is a consequence, or whether there is no physical problem whatsoever, the patient is only having anxiety, tension. So we need to ask the client to maintain sleep, follow sleep hygiene, like I mentioned during the presentation, the 6-7 points of maintaining good hygiene. But despite that, suppose if the patient is yet not able to fall asleep and is having these problems, then we categorically label it as insomnia. And then there are ways of treating insomnia. So we have to there are medications for that. We have short acting, mid acting benzodiazepines that we usually advise the patient to take. But largely, if we look at if we just look at things that we need to do before starting medication, then I think stick to a schedule. One does not need to keep looking at the clock that tick tick लगा के अभी 2 बज गए, नींद नहीं आ रही, then performance anxiety हो जाती है, उसमें और नींद नहीं आती है ना. We need to tell the client not to lie in the bed and keep scrolling, because blue light जब emit होती है तो further it makes it difficult to fall asleep. Bed is only meant for sleeping. It is not meant for watching TV, watching mobile में devices में कुछ अपने देख रहे हैं, या फिर उसमें बैठ के किताब पढ़ रहे हैं, या उसमें बैठ के खाना खा रहे हैं. Bed is only and only meant for sleeping, है ना. And we also advise a lot of times that before sleeping, tryptophan जो होता है, केमिकल होता है, जो बहुत सारे नेचुरल सोर्सेज में पाया जाता है, उससे हमें नींद आ जाती है अच्छी. तो बनाना में होता है, मिल्क में होता है, चॉकलेट में होता है। तो यूजुअली हम पेशेंट को एडवाइस करते हैं कि सोने से आधे घंटे पहले आधा कप गुनगुना दूध पी लो, एक केला खा लो, थोड़ा चॉकलेट ले लो, ब्रिस्क, बहुत एग्रेसिव एक्सरसाइज नहीं करनी है, go for a stroll, tire yourself out, and avoid taking coffee and tea and nicotine before bedtime. Do not drink excessive water, otherwise the patient will keep going to the loo, and so these are a few things that we advise the patient to follow for, and it's very much treatable.
So I think if I get it right, Dr. Rakshana, I think insomnia is only when you don't get sleep for weeks together. It's not like 3 days you've not got sleep, so you suddenly brand yourself as having insomnia. Is that message right? Which I have understood, Dr. Rakshana?
Okay, so I would just like to add that there are various forms. So you could have, you could have primary, secondary, tertiary, you could have various forms. Sometimes, what happens is it's of course, certainly what you're saying, it's not that 4 din neend nahi aayi to aapko insomnia ho gaya, not at all. It is something which you've been facing over weeks, right? And so it could be, let's say, sometimes we have a condition where we lie down on the bed, we lie down and we are lying down on the bed for a couple of hours and we don't fall into sleep, right? That's the primary. Then there is something when we lie down into bed, then we wake up in the middle of the night, keep tossing and turning for a couple of hours, unable to go back to sleep and then go back to sleep. Then there's a third kind where you are waking up a couple of hours prior to the alarm ringing. Again, you're tossing and turning, desperate for sleep and not able to sleep back. So there could be various forms, this could be identified. Then another fourth kind is where you are lying down in bed. You lie down also for 8 hours. But when you wake up in the morning, you don't feel refreshed. Now, once in a while, yes, but if it is a pattern that you are facing, then this definitely needs to be taken to a mental health expert, because, and like how Dr. Ratika said, yes, we can maintain a simple sleep hygiene, like taking away screen time 1 hour prior to your bedtime, making sure you have a warm water shower before sleeping, or simply just dip your feet in warm water, putting on some relaxation music, putting on something light. Avoid doing anything very active for your brain at that time, whether it is, whether it's watching something very exciting or stimulating, or reading a science fiction or a criminal book. So anything which excites your mind, not to be done. Anything which starts to relax is to be done. So, reading some poetry, reading something enjoyable, listening to music, all those things can be incorporated. Having a nice warm cup of milk with half a spoon of honey, that's also fantastic, allows us some beautiful sleep. So if we incorporate all of this, and yet and incorporating means not for one night, and doing sufficient amount of physical exercise in the day. A lot of times we felt in the pandemic, especially, a lot of people were facing difficulties in sleep. One, because they were binge watching. Second was because they had totally skewed up the schedule of waking and sleeping times. It had got very, very altered. So keeping a discipline there. Thirdly, what we also saw was that people were not getting sufficient physical activity. So if we bring all that back, do all of that and start following some sleep hygiene, and yet if you feel you're doing it, you follow sleep hygiene for a few days, if you feel you're still unable to fall asleep or you're feeling distressed, please reach out to a mental health expert.
Right. Thank you. I just want a quick follow-up question on this is, if you're dreaming throughout the night, is that considered as a sound sleep in your terminology? Or you've been dreaming for the last 2 hours while you were asleep, and you have conditions when you know you are dreaming, but you're still in bed. So which of these fall under sound sleep and which of these do not fall under?
One is that, of course, please understand, dreams are nothing but a flushing mechanism of our system. So we flush out a lot when we are dreaming. So dreams are also very, very important. So there are also restorative phenomena, like sleep is a restorative phenomena. But if we are having very disturbing dreams, or routinely we are seeing the same dreams, or we are having distressing dreams, or we are unable to wake up fresh, we are waking up distressed, then certainly it's affecting your mind. Then again, you need to see where is it coming from. The stem is not coming from, the dream is just is an end product. What is happening is there's something happening at the mind level, then that needs to be sorted out at the subconscious level.
So if you're dreaming peacefully, that means you're sleeping.
Yes, yes. And absolutely, sleep is divided into REM sleep and non-REM sleep. So if
Yeah.
you're in REM sleep, that is the phase where you're dreaming, you know. So that is a deep sleep.
All right. So I think there's a lot we've learned today, and there's so much more to learn, you know. I think each and every aspect which you have talked about, and mind is the most mysterious thing, which I think best of medical technology has also not been able to unravel this secret. So there'll be more research happening on this, and I'm sure there'll be more questions in our minds and a lot of thoughts, which we will definitely cover going forward. And somebody in the chat box even asked me, when is the next webinar on mental health? I'd definitely like to attend it. And they said, let's get Dr. Ratika Sharma and Dr. Rakshana Singh back. So I'm not sure whether I'll be able to do that. We will give chance to other experts, but you can definitely reach out to them if you would want to, for good reasons, I hope. And I'd like to propose a formal vote of thanks to our esteemed speakers and, of course, our co-chairs who joined us before we bring this session to an end. My heartfelt thanks to Dr. Khanna Singh, HOD Holistic Medicine and Wellness, Artemis Hospital at Gurgaon, and Director at the Mind and Wellness Studio. Thank you, Dr. Rakshana. I think very interesting aspects, deep into the minds, deep into the sleep, deep into psychological disorders, which you have unraveled today through your presentation and through answering the questions. It's been a great help. It's been a great help, I'm sure, to all the attendees. Though we can't see them, but a lot of them are putting smileys also in the chat box, which I'm sure will help their mental stress getting coming to a lower level just by discussing things. So thank you so much, Dr. Rachna, for being here this evening. My thanks also goes out to Dr. Ratika Sharma, consulting psychiatrist at the Gurgaon Multispecialty Clinic. Thank you, Dr. Ratika. And again, a wonderful presentation and also explaining a lot of things very clearly in simple language. And I think that's the best part of it. Both of you used such simple language, no jargons, which made it much easier for people on the screen. I mean, I am one of those who doesn't have a doctor in front of my name, but it was easy for me to understand and also help in asking the questions on behalf of the attendees. I'd like to thank Dr. Sameer Gupta, our co-chair for the Hospital and Diagnostics Committee of PhD Chamber of Commerce and Industry. I must mention he's also a director at the Cardiac Cath Lab of Metro Group of Hospitals, director at the Umkal Hospital in Gurgaon, and managing director of Aurum Senior and Assisted Living. Thank you, Dr. Sameer, for coming in and moderating the session. I know you had to be away for important case, and that's equally, if not more important, I think, attending to the patients who need immediate help. I'd like to also thank Dr. Deep Goyal in absentia. I think he'd had to log out, co-chair of the hospital and the diagnostics committee of PhD Chamber and senior director in HOD for robotic surgery at the Max BLK Hospital. Thank you, Dr. Goyal. I'd like to thank all the attendees who've been here throughout the evening. We've overshot by almost 1 hour, but then we still have our people there. Thank you all the attendees for being there and listening in so patiently. I hope we've been able to answer all your queries. Await the announcement for the next one to be announced, and you're most welcome to join us again. And I'd like to thank the doctor who has not spoken at all, Dr. Ravi Rathod. Though he's not a medical doctor, he's a clinical trial specialist, but he's still a doctor nevertheless. So who has been assisting me in the health committees, one of them which happens to be the hospital and the diagnostics committee. Thank you, Dr. Ravi, for making things so simple and easy in terms of executing this program.
Thank you, sir.
Thank you, one and all, and have a good evening. And like all the smileys which I'm getting in the chat, keep smiling. I think that's the root cause. that needs no psychologist or psychiatrist to tell you that. And I think if you keep smiling like our two doctors are smiling, you'll never have a mental illness problem. Thank you.